I'm Dr. Robert Lewis, a neurosurgeon and the director of the Skull Base and Pituitary Tumor Program at Hoag Neurosciences Institute. My specialty is minimally invasive skull base and pituitary tumor surgery. So basically I focus on bringing new techniques and technology into the realm of brain tumor surgery, allowing us to access tumors through smaller and less invasive approaches. I was introduced to surgical theater in 2015. I saw this immediately and I was like, wow, this is a giant step forward in the way that we prepare for and complete these procedures. Not only does it allow the surgeon to choose the best particular approach for each patient, it allows the patients to have a better understanding of what's going on in their own brain.
My name is Lynne. I'm a clinical dietitian, registered dietitian nutritionist, and I specialize in oncology, and I work at Mission Hospital. I love to read. I read some self-help books, I read novels. Suspense is probably my favorite. Well, my husband Eric and I have been married for 40 years.
We have a strong connection with our faith. We met on a water ski trip through a church youth group. I saw her on the beach and my buddy kind of nudged me and said, that's the girl you want to marry, and 4.5 years later I did. I work for Children of the Nations. We work with orphan and destitute children.
I was told by my optometrist that I had lost some peripheral vision in my left eye. So that began a journey to a few different doctors and then eventually to a neuro-ophthalmologist. And she said, you definitely have a tumor in there. That was really scary. You don't know whether it's malignant or benign. We had a lot of questions and concerns.
Okay, so we're going to have you take a seat here, and we're going to look at both the 2D images like we saw before, as well as the three-dimensional reconstructions.
He said, here, put on these glasses, and you can see exactly what's inside your head.
We're going to have you go ahead and put the headset on, and you can see immediately how this 3D reconstruction is much more intuitive.
I was really relieved, and I felt confident knowing that Dr. Lewis was able to practice.
In Lynne's case, there were several different possible approaches. I knew that from the preoperative rehearsal with the surgical theater, we would not be able to get the whole tumor out by going through the nose. I came to the conclusion that the supraorbital or the eyebrow craniotomy would be the best for Lynne's particular case. We did the surgery as planned. The operation took about 5 hours. We used the surgical theater and navigation during surgery to tell us exactly where we are. We were able to perform a complete removal of the tumor. And most importantly, after surgery, Lynne's vision immediately started to recover and has continued to improve since.
Now my eyesight's 20/20, and I can do anything that I did before.
You never know what's going to happen tomorrow. We count every day as a blessing.
I'm really grateful. Thank you.